All right, good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for Wednesday, February 14th, 2024. My name is Julia Gross. I am a research project specialist at KU's Center for Public Partnerships and Research, and I will be your webinar facilitator for today. I am also joined by my colleague, Erica Figueroa, who will be dropping all relevant links from today's presentation into the chat, as well as monitoring the chat for all of your questions and comments throughout the presentations. So to start us off, just as always, our webinar cadence for 2024, we will always have these webinars on the second Wednesday of the month. Everybody should have these on their calendars at this point. But if you have been registered since last year and you do not, you can shoot me an email at jgruss, Gruss, at ku.edu, and I can help you get that onto your calendars. Today, we also have a few of my other CPPR colleagues presenting for you. To start us off, we have Emily Bertels Kaufman and Sushmita Samaddar, who work on our early childhood integrated data systems team, and they will be giving you an overview and a demonstration of the recently launched Distinct Count dashboard. Then Lindsay Orion will be providing some information about Kansas's early childhood governance and the upcoming governance summit. Stick around after the presentations because I will have a few early childhood systems updates for you. But we will kick it off with Emily and Sushmita. So the floor is yours.
Cool. Thanks, Julia. Appreciate it. Thanks for having us. And we're excited to share with folks a new tool, a new baby tool that just launched in December that we're calling the Distinct Count of Children Served Dashboard. I'll go to the next slide. And the goal with this tool was to gather a number of children served across the state from different systems. So there were many, there's documentation around individual systems and the number served within those, but there really has not existed before a means to see across systems, to see at a child level, how is that child being served? So we looked across data systems at the state level, and we wanted to present this in a visual way, an easily accessible way that was had some pretty colors on it and was nice and simple, that was useful to folks. So we are currently in phase 1, and what that looks like is we worked hard with different systems and agencies to gather aggregate data at this point. It was either from the system itself, from the agency, or it was publicly available in some location. And to kind of support folks in not having to go here and here and here to gather this data, we have pulled it all together. I will say that you'll see in parentheses above the unduplicated count, that is our dream. That looks like individual level data instead of aggregate. For lots of very good reasons, that's very hard to get the individual level data. There's the privacy, there's system level barriers that come into play there, but that information would provide a really rich resource. Until that point, we have this tool to use. And you'll see on the right there, the 4 systems that we gathered for this first effort really focused on the child, the individual, the child, and not their system so much, but the child themselves, and really the biggest systems we could find, the biggest we could pull in. So at this point, it's childcare, public pre-K, which includes Part B for this effort, Part C, and home visiting. Those are the areas we gathered for this tool. So if you'll go to the next slide, we will go ahead and dive into the tool itself. I'm going to pass it to Sushmita to pull up the landing page. And we will go ahead and click through. This site is live now, and you can get the link after the webinar, I believe, or during. But you'll see here what we are calling the landing page. And when we designed this, we sought to really have some high-level context, not in detail, just high level, and a link to a methodology page that really is very detailed and very has all of the information about how we gathered the data, the methods we used, and has a lot of great information in it. So you'll see then as Sushmita scrolls down, the link is right by that arrow. And it will open up the dashboard itself. And I'm going to pass it now to Sushmita to kind of guide us through some of the basic functionality there at the top.
Thanks, Emily. So this is what the dashboard really looks like at the very start. Because I have been on this dashboard before, the disclaimer does not show up. But when you come onto the dashboard for the first time, there's a pop-up disclaimer. That's the first thing that you will see. And this pop-up disclaimer really gives a little bit of context into the dashboard itself. We as a team really made a concerted effort to accurately count the number of children being served in the mixed delivery system. However, as Emily mentioned, we were using aggregated data. So some of these data sources may include some duplicates. Some of the data sources may have self-reported data, or some of those data sources have demographic, did not have demographic or geographic breakdowns of counts. So this is the first view that a user does get, which is providing a little bit more context into the dashboard itself. And it also gives a link to the methodology page so that a user can get a little bit more information about how we gathered this information. So once you close that disclaimer pop-up, it won't show up again for you as a user if you've been to the page before, but you can always access that disclaimer through this little widget on the top of the dashboard itself. Right at the very top, we also provide for the current reporting year, we provide what the estimated number of children are who are aged birth through 5. And this just is a number that we pull from the ECIDS survey in 2022. And this allows the user to get a little bit more information about the overall population and to be able to contextualize the numbers that we are seeing with the overall population itself. Scrolling down, this is what the county level view looks like. So here you can see the big total number. These are the number of children being served, birth through 5. Caveat over here is that this count may include some duplicates from data sources, but they may also not be counting a few programs and services for which we did not receive data. So there's always a little bit more context around each of the numbers that we provide. Within the map itself, as you hover over the map, you can see some caveats on each of the counts. So in order to ensure that we maintain the privacy of counts that are less than 10, we did add some random noise to some totals in the counts. So that random noise is minimal. And really aggregated out to 0. So, if you take all of the numbers together, add them up, that noise or the distance between the real number and the accurate number and the manipulated number will be 0. So that's the way that we've added random noise in order to ensure that we maintain privacy, but we stay close to the accuracy of the total numbers. The darker greens in the map they refer to places which have higher service, versus the lighter greens are places with lower service. So it's really just contextualizing the numbers that you already see on the screen with the way with a visual that says the same thing. Just going up over here and showing some of the features on top of the dashboard, you see a county breakdown, but you can also see a region breakdown for the same numbers. So you can see the DCF service regions being mapped out over here, and you will be able to see the counts of children being served per DCF service region as well. And then if you want, you can go into specific mixed delivery systems to be able to see the specific numbers of children being served for each mixed delivery system. So we can see the total number of children being served in childcare, in home visiting, in Part C, and then finally pre-K. So going into home visiting real quick to show some of the advanced filters, there are many ways in which you can parse out and really dig into the data. So for example, you can look at specific data sources. You can look at specific initiatives meaning programs or services being provided under home visiting. You can look at specific interventions or intervention types. So within home visiting, there could be specific evidence-based models that you are interested in, for example, parents as teachers or universal home visiting. You can look at those and parse them out as well within the data. And then finally, you can look at specific demographic features. So if you want to look at age, ethnicity, race, or sex, you'll be able to do that within the dashboard for specific mixed delivery systems. So for example, if I wanted to look at a specific program like Family First, I can go on to the data source for Department for Children and Families. And then I can look at the initiative for Family First prevention. And then I can see over here the number of children being served through Family First. At any point, I can reset the filters and it'll go back to the default view, which is for all services and a county map. So this is a quick overview of all of the features within the dashboard. I'm gonna take it to Emily to talk about some of the use cases for this dashboard.
Thanks, Sushmita. Yeah, so one of the use cases we've identified and we kind of used as we designed this tool is around, an organization that might need to put out a needs assessment. Especially like, for example, around home visiting. If you needed information about home visiting and some demographic information around a child who's Hispanic, you can click home visiting as Sushmita has shown, pull open advanced filters, and then scroll over to demographics, ethnicity, and then demographic options and Hispanic, and you'll see the number change, showing all Hispanic children receiving home visiting services. Another example that you could use in real life is around looking at, as Sushmita mentioned, the home visiting models. So you can specifically pull up home visiting as is shown. And then the data source being all data sources. Initiative would be parents as teachers. And that shows the children receiving parents as teacher services. And then you can even further drill down into the demographics of those children. So if you scroll back up, Sushmita, and identify demographic ethnicity and Hispanic, again, you can see a more fine-grained number of children receiving parents as teacher services who are Hispanic. One more use case that we identified as being potentially helpful to folks is on the detailed view. So up in the right corner, Sushmita, the detailed view. Say that you want to look at a specific region, but it's maybe not a DCF region or the whole state. You want to look at certain counties and even combined counties. You can, for example, look at Senate District 24, which is Saline County and Dickinson County. And you can combine those two counties to show the number of children served in the two counties together, with some breakdowns below around the services, age, and different demographic information there. So this shows just those two counties, and you can kind of combine counties as you need. So those are just a few examples of how you might use this in your daily life. I'm gonna pass it now back to Sushmita for, she's mentioned some of these, but some of the caveats and the disclaimers around this data back on the slideshow.
Thanks, Emily. Julia, could you? Yeah, thank you for putting that on full screen. Some of the key disclaimers, we've talked about this a little bit throughout the presentation, but want to create some space to talk about some of the limitations and some of the context to think about as we're interpreting this data. So this version of the dashboard might lack certain data sources. So we have tried to include as many programs and services within the context of home visiting, pre-K, childcare, and Part C. However, there could be a few data sources that we are missing. For example, privately funded home visiting or federally funded Head Start. And we continue to make efforts in order to include more and more data sources and ensure that that count becomes as close to the accurate count as possible. Some data sources lacked demographic information, and so there are certain views on the dashboard where you will not be able to drill down to certain demographic categories, and that's because some of the data sources just did not have those demographic categories added in. That's going to also impact your detailed view. So as you're looking at the detailed view, some race, age, sex, and ethnicity counts may not add up to the total, and that may be driven by the fact that there are some data sources that do not have those counts broken down by those demographic categories. Some programs, we receive that data based on provider location. So as Emily started off the presentation, she talked about how this dashboard is really about counting the number of children being served. And one key aspect of defining what service for children means is that we look at the child location, where the child is located, and service to the child based on the child location. For the most part, for all of the data sources that we looked at, we tried our best to have the data be organized by child location. However, for some of the data sources, we did not receive data as per child location. So that would be, for data sources like parents as teachers, where we receive the data from at the provider location level. And so the counts that are being displayed are a little bit different for those data sources versus the rest of the data sources in the dashboard. And then finally, we work with aggregate data. So we were unable to deduplicate across programs for places where we used aggregate data. Our hope and our ambition is, as we keep refining this dashboard, we continue to make this count as accurate as possible. And so with receiving more and more individual level data, we will be able to deduplicate across programs wherever possible. At this point, this dashboard is just looking at aggregate data, but in the future, we have ambitions to be able to get a much more accurate count as well. The methodology document that is linked out in the landing page and also in the pop-up disclaimer of the dashboard includes all of these details and much more about where we got the data from, what was the process that we took in order to build out the dashboard. It goes a lot more in detail on the kind of data transformations that we made in order to make the data ready and available for the dashboard. So if you're curious, that would be the place to go for more information about the data. Emily, back onto you.
Yeah. As we kind of start to close out this presentation, I did want to put in a plug for the Kansas Early Childhood Data Trust. This is an entity that's comprised of about 5 representatives from really the key agencies in the state serving children, DCF, KSDE, the Children's Cabinet, KDHE, and there's one more. That is a very important group that I can't recall right this second. But the goal of their group is to put out projects such as this, to share data across their agencies, to improve quality, effectiveness, equity of programs. Thanks, Erica. It's the Department of Corrections is the 5th one. And so far, this is the 2nd project that the Data Trust has put out. The first one looked at 2 data sets, one from the Children's Cabinet and one from DCF, to look at the link between the Early Childhood Block Grant and the prevention of foster care removals. So using that data to arrive at some findings. And the findings were that it did indeed have an impact to receive those services. So some neat projects that are coming out of this group as a result of some talking across systems. And as Sushmita talked about, and I talked about, we have quite a few plans for this dashboard in the next year and beyond. Our next focus is adding census data to the dashboard so that there's a mechanism for knowing the lay of the land in terms of population and information that exists in the census. So even more information in one place alongside the dashboard. We will pull in next year's data. So Sushmita noted the dates of the data that's currently on the dashboard. We will pull in this next year and have that on the dashboard itself in fall, I believe. And then we have had feedback from folks that it would be helpful to have some more explanations on the dashboard itself around some of the caveats Sushmita described, some of the limitations or interpretations, and we're working on adding those in a clear way, a helpful way. And obviously, we are a small group at KU, and we are happy to receive any kind of feedback that you have as you listen today and go forth and use this tool. Our contact information is on the next slide, but we really do hear that feedback and adjust as we can. One last plug is for a webinar that our crew is putting forth called the Stellar Insights webinar. We plan to have a virtual webinar on March 28th. This is really the first in a couple of webinars, a series being put on by our team. And we're really looking during those webinars at existing data tools, how to use those tools, why use them, and just having a space for folks who love the data, know its power to collaborate together and continue building across systems to support to support our kiddos in Kansas. The next slide will round us out. We have linked to the dashboard. Erica provided that in the chat. The link to a little light reading, the methodology documentation, and our contact information, should you have questions or feedback. So now I think is the time where we can open up for questions that you have right this second.
Yes, if there are any questions, please feel free to utilize the chat feature.
Questions are fine, and some kudos are great too. Thank you. Thanks, Cora.
Just giving y'all a couple seconds just in case if we have any questions, but as Emily said, you can always use their contact information there at ecids@ku.edu if you think of anything in the future.
I did see a hand go up from someone. They're gone. Is it Rebecca?
It's Renika. I'm sorry. I was trying to give you a thumbs up. Thank you for your information.
Oh, good.
Alrighty, well, a big thank you to Emily and Sushmita for that very detailed presentation and demonstration. Thank you for being here. We very much appreciate your time, and we will keep it moving. And next we have Lindsay Orion from KU's CPPR talking to us about early childhood governance and some details on the governance summit that we are having this Friday. Lindsay, we are ready for you.
Thanks, Julia, and hi, everyone. Nice to be with you today. Before we jump into the summit itself, I wanted to provide just a little bit of background. So I'll start with a little bit of background on the early childhood governance structure here in Kansas. So have a nice, pretty little chart up on the screen for you. A couple of key pieces that I want to just give context and placement for is the early childhood recommendations panel. So to start, the Kansas Executive Order 2002 designated the Kansas Children's Cabinet and Trust Fund as the State Advisory Council on Early Childhood Care and Education. And the panel, the recommendations panel, serves as an advisory group to the Children's Cabinet to support these responsibilities. So that's kind of how everything fits together. Everything rolls up to the governor ultimately. And we have so many, this chart is not inclusive of every single early childhood governance group or group within the system, but there's several listed here as examples and representatives. And the early childhood governance groups are, able to raise and elevate ideas, concerns, anything along those lines to the early childhood recommendations panel. So a little bit more about the panel as we move forward. On the next slide, I have details about the panel. The recommendations panel meets monthly. It's a pretty large group. We currently have, I think, 44 members. Maybe I have another slide on that. I think that's coming up soon. But if not, we meet virtually. So the third Friday of every month from 9 to 11, all of our meetings are live streamed on the Children's Cabinet YouTube channel. So we certainly invite anyone within the early childhood system to watch those meetings. And we have an opportunity for anyone to submit written comments or sign up to request a time to come and share verbal comments with the panel. So if there isn't sort of a natural avenue for someone who's interested to elevate something up through early childhood governance groups to the panel or through any of the panel members, it's open to all to provide input, feedback, ideas, comments. So there is a link there. So that's available. And then we always post all of the meeting materials on the Children's Cabinet website. So You can always keep up to date if you miss a meeting or are curious or hear about a topic that was presented or discussed at a meeting. You can go back and see the slides, the meeting materials, and also the meeting recording. So if you can't watch live, we always save them for later. Next up, the reason for a lot of this background is that the Early Childhood Governance Summit is being sort of hosted by and during the panel meeting that would normally fall on Friday, February 16th. So this is our third annual Early Childhood Governance Summit. And the goals of this were to offer an opportunity to bring a variety of early childhood governance groups together in one place to sort of talk about progress, accomplishments, goals, things to look forward to over the next year, and to have the opportunity to make connections across the early childhood system. We know that there is a vast amount of amazing work that is happening throughout Kansas. And this is just one way for us to be able to help highlight that, but also to help everyone know what else everyone is doing. So let's see. Anyway, talked about the goals. I think next up I have our groups who are going to be joining us this year. Yes. So these are the groups that have joined us actually last year and are joining again this year. If you see a group that's not represented that you would hope to see, feel free to reach out. We would be happy to consider additional invitations and look at different possibilities. But these are the groups that you'll be able to see represented at the Governance Summit this Friday. The last piece that I have is just an example of last year. So the 2023 Summit, again, featured those same 13 different groups from across Kansas who inform programs and services across different aspects of the early childhood mixed delivery system. On the Children's Cabinet website, we have a summary of the event, we have a link to the recording, we have all of the slides from the groups, and we have two really beautiful graphic recordings that were completed from that event. We are hoping to have graphic recordings from this event this year as well, but our amazing graphic recording artist is out on leave currently. So we're hoping that that will be able to happen a little bit further down the line. And if so, we will certainly add those to the website and share them once everything is complete. So the Governance Summit, again, is viewable on the Children's Cabinet YouTube. You can join and watch live. We will, of course, have the recording available. And just want to encourage others to participate, come and hear about all the amazing work happening, and have the opportunity to sort of create additional connections across the system. I am open for questions if anyone has any or comments, but that's all I have today for that plug.
Thank you so much, Lindsay. And as Lindsay was sharing, Erica was also sharing all of those relevant links in the chat as well. So you can refer back to those. So if there are any questions, go ahead and use that chat feature. And if not, I can just move on to our early childhood systems updates. Thank you so much, Lindsay, for coming on and giving us that detailed information about our governance structure and the summit that is coming up this Friday.
Absolutely, I appreciate it. And I would be remiss if I didn't give a plug for all the work Julia has also done to help make this happen. So just a thank you to you as well.
Thank you so much, Lindsay. All righty, we will get into our early childhood systems updates. First off, we have some grant opportunities from the Child Care Health Consultant Network at Child Care Aware of Kansas that they wanted us to share with you today. These are some new provider grant opportunities that are ending soon. So any new licensed childcare providers that have opened their doors in the last 3 months may be eligible for these grants. They have a health and safety grant, which applications are due by March 7th, as well as a startup stipend with applications due by March 21st. So if you would like more information about either of these grant opportunities, you can reach out to the Child Care Health Consultant Network. Their email address on screen, as you can see, is cchc@ks.childcareaware.org, as well as a phone number. You can reach them at 785-823-3343, or you can visit their website that Erica has put the link in the chat for. So if these are some grant opportunities that you think apply to you and you are interested in, please reach out to the Child Care Health Consultant Network. Next, we have our Early Learning Advocacy Day. This day is dedicated to forming relationships with lawmakers and sharing firsthand stories about Kansas's childcare and early learning systems. So Advocacy Day begins at the Kansas Health Institute to learn about advocating and telling your own story. And then later in the State House, you can meet with your lawmakers, connect with other early learning advocates, and have lunch with other professionals. So this Early Learning Advocacy Day is on March 6th from 9 to 2 p.m. in Topeka. You can register by following the link in the chat, and those registrations need to be submitted by February 23rd. So we are approaching that date. But the programs that are included at this Early Learning Advocacy Day are You Belong Here, Elevate Your Voice, Reading in the Rotunda, Lawmaker Visits, House and Senate Chamber Proceedings, Early Learning Caucus, Lawmaker Debrief, and Capitol Building Tours. So if you are interested in participating in this Early Learning Advocacy Day, go ahead and get registered by February 23rd. Next are our early childhood conferences that we have coming up. First is the Governor's Public Health Conference that is being held from March 4th through the 6th at the Hyatt Regency in Wichita, Kansas. I will say that the website has given the update that the Hyatt has been filled as of late January, but they have 2 overflow hotels that are listed on the website as options if you would like to attend this conference. So at the conference, you will examine the unique challenges and opportunities faced by rural communities and the roles of innovation and technology in fostering rural economic development. Learn about successful interventions and initiatives that promote health equity, and learn evidence-based strategies and techniques for managing and reducing stress in both personal and professional settings. So join us for this transformative experience as we bring together national speakers, state leaders, and regional experts to address crucial issues in public health. Together, we aim to build a healthier and more resilient Kansas. You can learn more and register at the link that Erica is putting in the chat for you. And then also we have Camp GWC Early Childhood Annual Conference. This conference is on April 12th and 13th. The 12th will be all virtual, but the 13th will be in person, also at the Hyatt Regency Hotel in Wichita, Kansas. Camp GWC is an annual early childhood conference that brings together educators, professionals, and parents to explore the latest developments in the field of early childhood education. The conference features a variety of workshops, keynote speakers, and networking opportunities designed to enhance the knowledge and skills of those working with children. There will be another link in the chat where you can go to learn more about Camp GWC. As always, we have our reminders for our upcoming meetings. As Lindsay discussed, our 2024 third annual Early Childhood Governance Summit is being held this Friday, February 16th from 9 to 11:30 a.m. You can watch this by going to the Children's Cabinet YouTube, where we will be live streaming that meeting. Our next Early Childhood Systems Building webinar is going to be on Wednesday, March 13th from noon to 1. And our upcoming Children's Cabinet meeting is on Friday, April 5th from 9 to 12. As always, you can find these meetings and more on the Children's Cabinet YouTube channel, where we either post the recordings or live streams are available at the time of the events. Thank you so much for your time and attention today. As always, please sign up for our weekly All In for Kansas Kids e-newsletter. You can follow us on Twitter, otherwise known as X, and you can also subscribe to the Children's Cabinet YouTube channel to stay up to date on all of those meetings and live streams. Again, thank you so much for everyone that has come today, and thank you for our presenters. We will see you next month.